Bonjour à tous. Donc, on va poursuivre nos présentations avec le docteur Kuldeep, qu'on remercie, qui va nous traiter le concept de fusion, combiner volume, contouring et perfection de la peau. Okay, Dr. Kuldeep, you are welcome again today with us. Thank you to being back today. For the next session, you will make the fusion concept, volume, contouring, and skin perfection. Thank you.
Thank you so much. And welcome back after the tea break. I hope you enjoyed all your athé. Kul shi bekhair? Yeah, good. You see, I've learned a little bit of Moroccan. Shouya, shouya. It's my first time lecturing in Morocco, so I'm very honored. I did a session yesterday for you where we harmonized the face, and I will show you also a live injection today. So, because it's my first time here, yes, all right. Because it's my first time here, I just introduce myself. I've been the global brand ambassador for Galderma for over 10 years, and I've been using their products for over 20 years. So I have quite a large experience to share with you all, and it's my pleasure to share that with you. Thank you. I just need this working. Hello?
Yes, la régie, s'il vous plaît.
Can we just see if this is working? Ah, there it is. Great. Okay. That's it. So, you may have noticed some of the big campaigns that Galderma do. This is one of the campaigns. Restauration for any and every look. As part of my role as global ambassador for Galderma, it is my role to inject. So all of these models that you see on all of the global campaigns have been injected by me for skin boosters, for Sculptra, and many other images that you see when you are at IMCAS Paris or you're in Monaco on the big screens. The patients
S'il vous plaît, un peu de
are all
silence
mine.
dans la salle. On l'entend pas. Vos voisins sont gênés. On l'entend pas du tout.
For some reason this isn't working. Okay. So this is essentially what everyone is afraid of today. Everyone is afraid of even the word dermal filler, injectables, hyaluronic acid, because these are the results that my patients, they show me on Instagram. And they say, Doctor, Jennifer Aniston can afford the best injectors in the world. So why is it that she looks like this? Why is it looks as if her filler is migrated, that she has a Tyndall effect? Her face has metamorphosized into a caricature of herself over a number of years. She is unrecognizable. So how is it that we, with our fillers over the last 20 years, I've injected over 1 million now, so I have a lot of experience. Our patients don't look like this. And all of that is in your control. It's in your hands. You choose the correct product, you place the correct amount, and you place it in the correct plane of injection. We have a large range of products, and we'll talk through some of them today. And you can pick and choose, because you are the artist. You are the sculptor. And as a result, can you have the next slide? We'll do it like this. Next slide. Can they do it? No. Okay. So as a result, we can do tear troughs like this. So this is a typical patient. We used in her Nasha, i.e. Restylane Classic, very tiny amounts, placed deep on the bone, and I will demonstrate that for you today when we do the live injection. So in total, would you believe we used 0.5 mil in total to rejuvenate her tear troughs. And the result lasts for 18 months, because this is Nasha technology, as many of you have heard, and Nasha technology has been around now for 30 years. We've done nearly 65 million treatments worldwide. And what happens over a period of time? People are afraid of pillow face. They're afraid of filler migrating, over-volumizing. This is a patient that I treated a few years ago now with Restylane skin boosters, the original skin booster, 18 years old, 6.5 million treatments worldwide. It is also Nasha. It contains just 1 degree of modification, so it draws very little water, and you can see that just with regular injections, even when the patient is smiling, which is what's most important. Because sometimes when we see our patients at rest, they look okay. But when they smile, the face changes and they don't look natural anymore. This is what we're able to do with skin boosters. And you'll notice that when she smiles, she looks very natural. 2015, 10 years ago now, I was very honored to be asked to lead a campaign for Galderma, which many of you may have seen. Many of you may have not, because you're very young in the audience here. So I was asked to treat 10 sets of identical twins, to treat one twin, but not the other twin, to show a real life before and after. And we followed the twins up for a number of years to see the difference between one and the other, and how subtle and natural the difference is. So these are Kelly and Stacy. We treated them in 2015, and at the time, I looked very much younger, and all of this work was endorsed by Sharon Stone, who endorses and sponsors my work around the world. And because of this, the campaign that we did, the Proof in Real Life campaign, which we are still doing, was seen by about 350 million people around the world. It was very broadly shared to show how natural our results can be using the Restylane range. I still see Kelly and Tracy. I saw them just a few weeks ago. As I say, I look a lot older. They look exactly the same. They don't look overdone. They don't look overfilled. They still look like the best version of themselves. And would you believe they are 48 years old now? And how do we achieve this? Very simple. We have two very distinct technologies. We have the Nasha technology, which is the Restylane Lift and the Restylane Classic and the Restylane Skin Boosters. We use the Restylane Lift any place that we want to create a firm projection. So this is ideal for the chin, it's ideal for the nose, it's ideal for the jawline, it's ideal for the zygomatic arch. Anywhere we want to create projection. We inject deep on the bone, and you'll see me do that in a few minutes' time. And then we have the other range within Restylane, which is the optimum balance technology. That's put together very differently. It's designed to create contour, and it's used in areas where you are animated, where you're smiling, in the perioral area and the cheek, and we'll see some of that as well. And you saw that yesterday, in fact, with the model that I treated with Restylane Define. So how does the Restylane range of fillers fit in to everything else that is there on the market? Essentially, what is very different, and you can see on the slide on the left-hand side, we compare the firmness, or the G prime, with the horizontal axis, which is flexibility, or X-strain. The idea of X-strain is to see how far you can stretch a gel before it loses its shape. So it bounces straight back to its exact shape. And this is very important when we're injecting subcutaneously and we're injecting in areas that are moving, for example, around the mouth, and particularly in the lips. We want everything to look very natural, and we want the gel to integrate into the tissues, and this is very important. So you have things which have a very high G prime, which can mimic bone, as we discussed, Restylane Lift, and things which are much more flexible, but they also have the ability to project and contour. And we take advantage of all of these things in order to produce the ideal result. So this isn't just marketing, it's not just clever photographs. The whole idea of this, that there is science behind it, and this is something that I'm very proud of associating. We're all doctors. We want to understand the science. We want to see clinical papers which are comparing, and you're able to measure the changes and quantify them. So this study, which was done by a friend of mine, Steve Weiner, from Florida, just last year, shows the ability of Voluma versus Restylane volume. And the difference is the X-strain, the ability of the gel, when you move, the ability of the gel to remain flexible, giving you natural expression, and bounce back. You can see what happens on the left-hand side in the purple with the Voluma. When the patients smile over a period of time, the gel begins to break up. Okay? So that means you have different amounts of hydration effects, and it creates an incongruence. Things aren't balanced. Whereas with the Restylane volume, you can see very clearly that it maintains its flexibility, and you can see that very clearly on the ultrasound. I might get this thing actually working by the time I finish. There we go. So, what does this actually look like for our patients? So if we compare the strain around the mouth in these two patients, you can see at the top a female aged 58, and the amount of strain on the left-hand side, that's the deep red color, that is happening in her skin. And you compare that to someone who is 35 years old, just at the bottom there. And after we've injected her on the right-hand side, you can see that the way she moves and the tension and the strain in her skin is equivalent to someone who is 23 years younger. And that's what we're able to do. But of course, she still looks very natural when she smiles. And that's exactly what we want. Let's take a typical patient that I saw just in the last week or so. She has already had a facelift, so there is no kind of sagging of the skin, but she's 66 years old. The skin is very thin, and you can see very clearly that, yes, okay, you've had a facelift, but you're not looking particularly refreshed. You're still looking very tired. She's still looking very skeletal. You can see the bony skeleton by her temples in the mid-face, and you can still see a little bit of marionette. So how are we able to improve this? And you can see the before and after taken with an HD Vectra camera. On the right-hand side, she looks a lot more refreshed. She looks a lot more youthful, less tired. And here we used Restylane volume in the temple. We used Restylane define in the mid-face, like we did yesterday. And then we used define and refine in the marionette type area, exactly like we saw on the study. And this is what were the results we got. And you can see that she looks very, very natural, and nothing would tell you that she's actually had any work done. Good. And this is what it looks like when we look at it in the black and white. And once again, you can see, because we treat shadow, and you see how much more tired she looks, particularly on the left-hand side, the nasojugal groove, the nasolabial fold, the marionette, and how much softer she looks afterwards. She's got a nice anterior cheek projection. She looks less tired, and the nasojugal groove is less hollow on both sides. And as I said, what we're doing here is actually something which is very delicate. It's very natural, but it is quantifiable. You can measure it. And this is what we're seeing with the Vectra scanner. In the deep blue is where the maximum amount of volume has increased. And you noticed in the first pictures that she was a little bit asymmetrical. She lacked volume on the left-hand side compared to her right-hand side. And you can see that what we've managed to do is change and lift the amount of skin and give her a much smoother contour, and we can actually measure. So the deeper blue tells you how much more that she looks volumized in those areas. So, I think enough talking. I'm going to go backstage now, and we're going to see a real-life model where we're going to look how we're going to balance the entire face with the Restylane portfolio. Thank you so much.
Okay, thank you, Dr. Kuldeep.
Wonderful.
We will pass to the live demonstration. Maybe if there is some question for Dr. Kuldeep before starting. Est-ce qu'il y a des questions au niveau de la salle pour la présentation de Dr. Kuldeep?
Do you want to put your phone away? That's it. Okay. Good. So from my side, we're ready. Can you see the patient? Can you check?
Yes.
Yes, you
Yes.
can. Oh, that's fabulous. Thank you so much. Okay. So here we have Fatim Zara. She is 28 years old, and she's not really had any injections done before. And you see, Morocco is a very broad country, so you have very different types of faces, given your history of over 300,000 years now. So this patient looks very different and has very different needs to our previous patient. So one of the first things that strikes me is that she has beautiful high cheekbones. You can see that very clearly. But what happens with the high cheekbones is that she is exposing her temple. So she's lost a little bit of that beautiful oval shape, okay? So we're going to fill this temple area, and we're going to create a nice harmony between the forehead and the zygomatic arch. The next thing you will notice is that she looks a little tired. If you can pop your chin down and your eyes going up, that's beautiful. And this is slightly worse in her right eye compared to her left eye. And this is coming from the tear trough deformity. And often what I do to my patients, I show them. I just press here and show that this is the volume that we'll be lifting and filling. If this makes a difference, you're a good candidate. And it makes her look less tired. And it's the same. Look up for me, please. And it's the same on the left-hand side. And you can see how that contour and shadow changes, okay? But of course, what's most interesting is what the patient looks like in profile, because her family, her friends, photographs, everyone will see her in 360 degrees, a holistic viewpoint. Could you just turn to the side? That's perfect. Thank you so much. Good. So it's very clear from here. Okay? That's perfect. Thank you. You can see that she has a little bit of retrognathia in the chin itself. And what we're looking to do, you have a line drawn from the lateral part of the mouth to the bottom lip, and you can see that she is very short in terms of her chin projection. And this is what we're going to actually improve today using Restylane Lift. Along with that, you can see she has also lost the contour. She's only 28. I think she's had too many Masimmen, if you ask me. But she has lost the contour between her face and her jawline and the neck. And we're going to improve this, as I said, using some Restylane Lift. So let's get to work. Do you want to get back into the center? That's beautiful. Thank you so much. Good. Excellent. That's great. So we're going to start with the volume. Okay. And the cannula. Excellent. Pop your head back for me. So there are two ways we can actually treat the temple area. We can treat it using a deep injection. Many of you will know that as the gunshot technique. It was coined by Arthur Swift some 10, 12 years ago now. But in this case, I'm going to demonstrate a slightly different technique for you. I'm going to demonstrate the cannula technique using Restylane volume. Turn away from me. That's beautiful. Okay, if I could just have the pencil. So we mark first the temporal fusion line, the orbital margin, and the zygomatic arch. Okay, you can see that very briefly. I know I've just wiped her, which is why the markings aren't showing. There we go. Good. So this is the area that we're looking to improve, to give her more of a blend between her forehead and the zygoma. Okay? Good. So it's very clear. Great. Excellent. Thank you. And if I could just have a fresh gauze. Thank you so much. Yeah, just give me a fresh gauze. Wonderful. So first we're going to make the entry point. Okay. That's it. Beautifully. Turn away from me. That's beautiful. So I always like to pinch the skin because we don't want to cause too much discomfort. Perpendicular, little scratch, and you can just see that I've just allowed the bevel of the needle to enter the skin. That's all. Minor little twist, that's it, and allow the needle to sit there, because otherwise if you pull, just go straight in and straight out, the skin has a lot of elasticity, it tends to bounce back, and then you can't get your entry point. We release, and very gently take out the needle. Okay, that's wonderful, thank you so much. So in this case, I have a 22 gauge cannula, because what we don't want to do is in any way disturb any of the vasculature, okay? And this is Restylane volume. Wonderful, thank you so much. Good. So this is actually going to go into layer number 2, okay? So just immediately in the subcutaneous layer. And you can see that by the fact that you can see the shadow of the cannula itself, okay? So I know I'm in the correct layer. I'm gently, very gently advancing the cannula, maintaining the layer of skin, and you can see that very clearly, okay? Sometimes it can be a little bit uncomfortable, and if it gets uncomfortable, what you can do is inject just a tiny amount, which creates a bit of tissue separation, but also anesthetizes the area, gives a little bit of anesthetic, okay? And that allows you to advance the cannula further. So this is right up to her temporal fusion line, and you can see that very clearly where my fingertip is, and this is where we want to start injecting. It's a very gentle retrograde injection, always being aware of where is the tip of your cannula. There we go. So I've stopped injecting here, which is right at the height of her zygomatic arch. Okay? I warn patients that for a few days that she may notice that there's a little bit of swelling there, but it settles very quickly, and just tiny threads, about 0.1, 0.2 mil per thread, I've stopped injecting. You can see there. This is very important because we don't want excess volume over the zygomatic arch. Okay? And I'm just advancing the cannula very gently. Sometimes you can just twist it. You can see what I'm doing here because this tissue is very tight. If I'm getting a little bit stuck like I am here, I will inject just a small amount, like so. That allows for a little bit of anesthetic, and it allows me just to advance the cannula a little bit further.
Hi, Dr. Kuldeep.
Yes.
May I interrupt you for a question?
You most certainly can.
Thank you. So I would like to congratulate you for your nice presentation. And my question is about this technique with cannula.
Yes.
Sometimes when we have very thin skin,
Yes.
we may have irregularities when
Yes.
we inject with
Yes.
the cannula.
Yes.
So that's sometimes it's making me choose more the gunshot technique.
Yes.
So my question for you is, do you have a trick to avoid that irregularities?
Fantastic question.
Thank you so much.
Thank you so much. Absolutely. So it's a question of two things. Well, a few things, let's say. I try and simplify things as much as I can. One is the quality of the skin. So in an older patient with thin skin, we would inject a product which is a little bit finer. Okay? So something like Restylane Refine. That's what we would inject. And that's the idea of having a huge portfolio and understanding the tissue quality and what you're trying to achieve in which layer for which patient at which age.
So you may suggest that we combine like Volime deep in the bone and then
yes,
superficially
something like
refine?
Restylane Refine, exactly.
Yeah, like
and as you
sandwich
can
technique.
also see, with this young lady, I used Restylane Volume in layer 2, and the reason I made that choice is because she is young, she has good skin, And you saw the initial irregularities, yes? Correct. Now look, there's very little irregularity at all. Very gentle massage, and you can see that she has much less irregularity. You see? So just a gentle massage is all she needs, and then within about 24 to 48 hours, this will begin to really integrate into the skin exactly as it's meant to be. So yes, you have to warn patients sometimes that this can take 1 or 2 days, but very much it's about the product. If it was thin skin, we would use Refine. She's got thick skin. You can see there's very little irregularity already to see. And she looks much more balanced already.
Excuse me for the
Yes.
interruption again.
Yes.
It's again me. Don't you think that we need to add her like maybe 0.4 bolus on the bone?
So
Maybe if you see her, like you go a little bit far because we are seeing her in front and you're seeing her from the corner.
this is completely true.
So
let's.
in my opinion, if it was my patient in the clinic,
she just
I
needs
will.
a drop more, doesn't she?
Yeah, exactly.
Exactly. So let's do exactly that, which shows you that you can actually, I'm going to just use that with a red needle, that you can actually combine the two techniques very nicely. One of the reasons I choose the cannula over the needle is that if the maximum point where she has the depression is sitting in a safe area, i.e. 1 centimeter posterior to the lateral brow and 1 centimeter inferior, so we know this is a safe place to inject. We feel for the anterior branch of the superficial temporal artery. There's nothing to feel there, so I will inject deep on the bone. You can imagine, and I'm sure many of you have seen patients, she's a very young patient, small face, who have a large deficit throughout the temporal fossa, which is a very large fossa, and it also depends on their hairline. So for that patient, just putting one injection into this central point, the gunshot technique, it's not going to be enough. You're going to need to do multiple injections. And that's why, yes, you can combine with the maximum deficit here and then overlay it with the cannula. Absolutely correct. So I'm just going to do that now. Okay, so little scratch coming now. Well done. It's important that we're on the bone. It's the most important thing because everything is about the plane of injection. And a very slow and gentle aspiration to make sure that we're not in a vascular plane. But we are pretty certain when we are in this plane, okay, that this is the safe area. Now, what you can see is what I'm doing with my non-injecting hand. With my non-injecting hand, I'm placing my index finger by the hairline. And the idea of that is that we don't want the product to flow too far posteriorly, i.e. backwards. Because as I said to you, the temporal fossa is very large, and we want to fill the areas that are most visible, particularly for a young patient like this. Now, the other thing, of course, and this alludes to your question, thank you so much, is the fact that this gel, by its very nature, it wants to spread. So rest assured, if you remember, if we looked at the original photographs, when I showed you the ultrasound studies, this gel wants to spread. So over the next 2 to 3 days, it will actually spread. And this is exactly what we want to take advantage of. Okay? Excellent. Good. So now we're going to have a look at the tear trough. And in this case, what I like to do for my patients is I like to get them to look directly up towards the ceiling. Can you look up for me, like this? That's it. Chin down, head up. So what we're going to do there, that's it, and eyes looking up. Perfect, excellent. So the first thing to do is understand where is the bony margin, okay? I will feel this with my finger to begin with, and then I'll mark it out for you. That is the bony margin. That's the orbital rim. He said he'll mark it out. We may have to get a different marker pen. There we go. I think you can just see. Just there. This is the bony margin, okay? Just look straight at the camera. and just squint your eyes. Can you get her to do this? Squint like this, like this. That's it, that's it. Okay, so I'm getting her to squint. Now the reason I'm getting her to do that is there are two elements of orbicularis oculi muscle. The first element is the palpable element. Can you squint again? Like this? That's it. And you can see that. And then, squint again, is the ocular element of orbicularis oculi, which is lower down, because now it's a very large, thin muscle. In the junction between the palpable element and the ocular element lies the anatomical tear trough. And that's what we're going to inject now. And we're going to do this Restylane Classic. We're going to do it with a 30-gauge needle. Okay, and once again, this is Nasher technology, so different to what we had before. Can you just check that everything is visible on the screen and I'm not in the way? Yeah, good. Looking straight up? Perfect. So once again, with my non-injecting hand, which plays a really important role, the non-injecting hand, is to make sure I know where the bone is. I'm not injecting. I'm just showing there. That's the bone. This is the deficit. This is the separation between the muscle. Okay, so look up. And I approach, because she has a lot of veins here, so I'm going to approach from slightly laterally, slightly below, but my needle tip will end up here at the point of maximum deficit. I want to stretch the tissue, okay? There we go. We're deep on the bone already. And we're just going to aspirate. Very slow, very gentle. I'm looking very carefully by the needle tip. It's absolutely fine. And we're going to place a tiny, tiny volume. And the thing with your screen is you can probably appreciate what's going on already. And gently withdrawing. That's it. Look straight. Okay, good. And then what I do, I gently, you can look straight at the camera. That's it. I gently mold the filler. This is the Nasher Restylane Classic. Gently mold. The patient doesn't need to do anything at all. You just leave that exactly as it is. And you can see that this is looking better already. Look straight up. And we're going to work our way around the rest of the eye, which is essentially the nasojugal groove. It's no longer the tear trough, to be honest with you, because as soon as you come past the mid-papillary line, it is no longer the tear trough. It becomes the nasojugal groove, and then it becomes the palpebral malar groove. These are anatomical things which are quite important. And each time, I'm injecting about 0.1, just 0.1 mil deep on the bone. Look straight at the camera. That's beautiful, okay? And what we're aiming to do here is just to reduce the lid-cheek junction so she looks less tired. I'm gradually just molding. She doesn't need to do anything when she gets home. It's absolutely fine. And she's probably going to have one more injection slightly laterally. Once again, I'm aware of where the bone is. The bone is here, just where my needle tip is. The hollow is here. I'm going to approach from here, but the actual injection is going to sit here. Okay? So it's very clear. So once again, stretching the skin. So I have complete control. Straight down, and a very tiny injection. Now the thing is that a lot of the complications we see in tear trough are actually from cannula. I see complications every single day in my clinical practice from all over the world, would you believe? And a lot is from the cannula, because with the cannula you can't be absolutely sure which depth you are in. There we go. Excellent. Great. And you can see very clearly the difference. Of course, there's a little bit of redness. The gauze is a little rough. We've wiped the skin a few times. That's it. Look straight to the camera. That's beautiful. So already, she looks a lot more refreshed. And as I said, I always warn the patients that she may... Okay. I've just been told we have 12 minutes, so I need to speed up. Okay. So I always warn the patient that essentially there may be some swelling, there may be some bruising, but 9 times out of 10, neither of those things happen. Okay. So let's have a look at this chin, shall we? this way. Look straight at me. Is it okay on the screen? I'm not in the way? Good. So we're going to draw a line straight down. You can see that in terms of vertical fifths, the chin, although she's very wide across the bizygomatic diameter, the chin actually fits very nicely with her medial canthus, the nasal alar, and indeed the chin itself. So here is very good. But of course, what is not so great is the anterior projection. So I'm going to be injecting exactly in the center, okay? And I'm going to inject directly perpendicular to give her some projection, okay? She doesn't really need too much lengthening, so we're going to use some Restylane lift, if you remember. So this is the product that has the greatest G prime. If we can raise the couch, that'll be really good. It has the greatest G prime, so the greatest ability to physically lift. Yeah. That's it. Always inject the patient upright, completely upright, because this is what everyone is seeing. That's perfect. Thank you so much. Good. Can you see? Good. Excellent. So this is the Pagonian. I'm going to take the injection. I'm going to go straight into the center, and I'm on the bone. Now, what do we have here? It's normally lateral, but it is the submental artery. Okay? It's also mostly superficial. But for those reasons, I'm going to just aspirate as I'm doing here. And when we aspirate, you aspirate very, very gently, because we know, and I wrote a paper on this last year, which has been published, that if you actually are too aggressive with the aspiration, you are actually going to pull the artery towards you, or the artery will go into spasm. So you have to be very, very gentle. The tissue here is very tight, so I understand you're feeling a little bit of discomfort. I get that, because it's very tight. But notice the importance of my non-injecting hand. Okay? No tower technique, nothing like that, because we want to stay in the same plane. We're injecting deep on the periosteum, and we're pushing those tissues forward. I'm just taking the needle off the bone just a fraction to allow space for where I've actually injected the product, okay? And she had quite a significant retrognathia, so she will need, I think, certainly 1 mil in the center, and then possibly a little bit either side, because what we don't want to do is make the chin look too pointed, okay? So gradually withdraw, okay? Very good indeed. If you just take that and give me another lift, please. So.
Excuse me, Dr. Kuldeep, there is one question.
Yes.
In the assistant.
Good. Another lift, please.
Hello, doctor. Thank you for your presentation. I have a question about the tear through hollow. I saw that you injected under the RL, not the zygomatic ligaments. Is it right?
Say that again. We're talking about which?
About the tear through
Yes.
hollow. You
Yes.
injected under the RL ligaments, not the zygomatic ligaments, right?
100% correct. Excellent question.
Because,
I injected below the orbicularis retaining ligament.
Yes.
Correct.
And so,
yes.
yeah, my question is, like, with needles, isn't it risky because you have the infraorbitary artery that is like about 2-3 millimeters under the orbicular bone? So isn't it like more secure to work with the cannula, which is,
Excellent.
you said, isn't
Very good.
not good
Perfect
for you?
question. So, the infraorbital foramen actually sits approximately 7 to 10 millimeters below the orbital margin, okay?
Yes.
Her orbital margin is here. The infraorbital foramen is going to be here,
Oh, okay.
okay? So it's not 3 millimeters below. It's
Not in
between-
the center of
No,
la pupille.
no.
Okay.
It is actually
Oh,
sitting
yes.
about here. And I'm going to demonstrate it.
Yes.
If you can ask the patient if this is going to cause discomfort or pain, can you ask? Yeah, you saw her? I don't need to ask.
Oh, okay.
You felt her. She was like this. This is the infraorbital foramen.
Yes?
My needle entry
Okay.
point was here. I injected here. It's nowhere near the infraorbital foramen.
Okay, I thought
Okay?
it was like just...
No problem.
Okay, thank
No
you so
problem.
much.
Thank you for the question.
Do you have like a maximum dose that you need to inject, or that you not need to go below, over? Is
Say
it like 1.2 maybe, or one, not
It's
more?
about 0.1 to 0.2. I
Okay,
wouldn't
no
inject more
right?
than 0.2.
Okay.
Correct. Yeah.
For
For the
the edema.
most medial point, yes. For the
Okay.
most medial point,
Ah,
correct.
okay. Thank you so
Okay.
much. Yes.
So,
Thank you.
now we're not going to let this young lady go home with a chin that is now looking too pointed, although we see a lot of that, don't we? So, we're going to come slightly either side, and we're going to continue with the idea of projecting the chin. Okay, once again, I'm on the bone. Okay, she knows. She's doing really super well for someone who's never been injected before. I think she had her lips done about 3 years ago, but the lips at the moment are very natural. I'm watching very carefully where that needle is, because I want to make sure that there is no risk of any vascular occlusion. And if you remember, I injected the entire 1 mil into the center to give her that projection. And on this side, I think it's probably going to be about 0.4 per side. There is no hard and fast fixed rule. You have to do this just from what you're actually seeing. Okay? Good. Very good indeed. Excellent. And we'll come this side, and we're going to inject just here to give her, so we maintain the width of the chin, but at the same time give her the breadth that she needs. Okay. So I'm a little bit high there, because normally I would inject from the other side. That's it. Very good. So once again, deep on the bone, touching the bone, aspirating, making sure that we're not in the vessel, and giving a deep injection. Once again, she wasn't asymmetrical, unlike the young lady yesterday. So in her case, she's not asymmetrical, so she's going to get 0.4 per side. This can be a little bit uncomfortable because the tissues are very tight. We know that. There we go. Very good. So she's now had 0.4 per side. And notice again exactly what's happening with my non-injecting hand. It's really important. Okay? Good. Excellent. Okay. Can you turn to the side, please? No, your whole body. That's it? Excellent. Good. 10 minutes. Okay, good. If we can just, you can see what we've done there. Okay, just a little bit, chin up a little bit, just there, because I want to be able to capture it in the entire camera. That's excellent. And then just with a cotton bud, if I can just show. So, what's important for the chin? We can see this is the corner of the mouth. This is her lower lip. And look where the chin is sitting now. And remember, for a female chin, we do not want the chin to be touching this line. It normally needs to sit about 2 to 3 millimeters behind this line. We don't want to masculinize her, okay? I will let this settle, turn back again. And then if she needs some more, I will do that, but I will review the patient, if I can have a fresh needle. In a couple of weeks' time, allow any residual swelling or anything like that to settle, and then make a judgment as to what else she may need. So for me, she's still a little bit narrow, okay? So I'm going to give her a little bit more breadth. Deep on the bone. We know that plane is a lot safer. If we can open up some more Restauration lift, please. So 0.2 here, and it'll be the same the other side, just to give her that little bit of breadth, because what we don't want, could I have another Restauration lift, please? With a needle. Yeah.
You have 5 minutes, Dr. Kuldeep.
Okay, so I'm just going to finish the chin. Yeah, we'll just do it with a needle, fresh needle. And then I'm going to show you what I do with the jawline. There we go. Excellent. And we can set up a Restauration lift with a cannula, and that would be great. So you can see very clearly how we've maintained that width. Just needs a little bit more work on this left-hand side in keeping with her nasal layer, but we've given the projection required. Okay? So once again, keeping the tissues nice and tight. I'm deep on the bone, and I'm going to inject exactly what I did the other side, which was 0.2 mil, to give her the breadth that she needs, the width that she needs. Okay? Otherwise, it'll end up looking too pointed. Good. Excellent. Great. So if we turn to the side, and she looks a lot more kind of, can you turn right the way around, please? That's beautiful, thank you. And a lot more balanced. Now, patients or doctors often ask, do I treat the chin first or the jawline? Always the chin, because it will lengthen. You can see what we've done to her. Even the cervical angle has changed completely. And we've given her the beginnings of some shape across the jawline just by injecting her chin. Do you see that? Very natural. Great. Turn this way. So now I'm going to treat the actual jawline itself. You're going to come back just here. That's wonderful. If you can give me a pencil. Okay. So we're going to mark the jawline. Now, unlike an older patient, where we may be more afraid of the jowl, etc., and sagging in skin, in this case, we're not afraid of this. We want to define the jawline. This is the gonal point, just here, just in here. And we want to give her a nice definition of the jawline. And this is going to be my last injection, which will show you how we're able to perform this using the Restylane. Okay, little scratch, I know. Okay, once again. Now, in this case, I'm going to use Restylane Lift again, because she has good tissue quality. We want something with a high G prime that stays exactly where it is, and we want it to mimic the bone, to give her a nice, sharp definition. And that's what we want for her, okay? So I've just come to the contralateral side. Excellent. There we go. Yep, sorry. I'm just going to get into the plane, and then I'll get out of the way. Okay. There we go. Okay, thank you. Great. So now, we can see once again, we're in the subcutaneous plane. Okay? Because she has good quality skin. She has thick skin. I'm along the mandibular angle, gradually just advancing forward. It's a little bit uncomfortable. I appreciate that. She's been super brave for us. Okay? I'm going to face the bevel. I'm going to face the bevel down. This is the gonal point, and this is where my cannula ends. You can see it very clearly. I'm going to protect that area. I'm in the subcutaneous plane, and I'm going to give a bolus injection. And already, just with the bolus injection, you can see, I'm going to inject 0.5 because she really doesn't have much of a mandibular angle. You can see what we've managed to produce. Now, when we inject here, I'm going to make sure that the filler stays exactly where I place it. And I'm going to do a few passes to start to produce this lovely contour and this jawline. Can I have another Restylane Lift, please? Okay. Good. As I said, she has quite thick skin, so we need to be fairly generous. But you can see already, and if you can just load that up onto the cannula, that's wonderful. It's already done. Superb. Good. So unlike an older patient where we would avoid the jowl, in this case we want to create that lovely contour, that lovely projection. So we don't want to be avoiding the jowl at all. We want to actually make sure that she has a nice contour. Okay? Good. Excellent. Little bit ouch, I know. So we'd place most of the filler just slightly posterior. See, now I'm going to come slightly anterior. Just retrograde passes to make sure that we get a nice, smooth finish just above and just below the mandibular angle to give her the result that she wants, because we want to differentiate the neck from the face. Could you hold on to that? Give me a wet one, please. Wet gauze. Okay, so then just once again, a gentle massage. Okay, sorry about this. When I say gentle massage to a patient, I don't mean it, to be honest, but I'm not going to tell them that. In this case, I want to be quite firm. Okay, that's excellent. So, once again, minus the redness, you know that's just something that happens when we are doing the massage and wiping. You can sit forward, beautiful. That's it, just like this, that's it. And if we can just see how we're really beginning to form that lovely shadow demarking her face from her neck and the nice confluence with her chin. So much more balanced and youthful compared to the untreated side where she still looks very tired. You can see the skeletalization and there is no real definition.
Thank you, Dr. Kuldeep. We are delighted to thank you once again for your excellent presentation. I would ask if there is one or two questions more before we go to the next presentation. Est-ce qu'il y a des questions au niveau de la salle, s'il vous plaît, pour le Dr. Kuldeep?
You okay? Good. You want to have some water? Where's the water for her? You want this?
Please.
You want this one? Yeah, this one. Let me get out of your way. Well done. Good. Yeah. She doesn't need it. Take care. You can ask the IT guys, if not, we will just have to work. But it's okay. That's okay.
J'espère que vous avez savouré les démonstrations que vous avez eues. Et Nabila Azib, au lieu de bavarder, elle ne m'a même pas entendu. Nabila, viens nous faire l'honneur de donner un trophée. Donc voilà. Donc je vous remercie. C'était vraiment... Shukran. Alors si vous avez vu sa vidéo, c'est lui qui a dit « Kol shi bikhair ». C'est lui. Donc voilà. Donc on vous remercie pour vos excellentes démonstrations et on vous remet un petit cadeau symbolique, vraiment symbolique. Donc je le donne à Nabila qui va vous le remettre. Et merci Nabila de nous avoir honorés de ta présence. Et merci de m'appeler à 2 heures du matin pour me dire comment ça se passe.
Pour te dire que je t'aime et que tu as fait un merveilleux congrès. Regardez-moi le setup. Quelle organisation, toujours dans l'innovation, Bedia. C'est vraiment magnifique. Et ton audience est toujours au rendez-vous à 9 heures du matin. Ils sont tous là. Hein.
Tu ne connais pas notre slogan. La plupart le connaissent. Il y a les amis, il y a la famille, et il y a les amis qui deviennent la famille. Ça, c'est ma famille.
Merci, Badia. Et amazing speakers in this Congress, and I would like to congratulate you for your beautiful injection, explanation, assessment, wonderful result, without any bleeding or bruising. It's an honor to have you in Morocco.
That's so kind. Thank you. It's an honor to be here. Thank you so much. That's
Wow,
beautiful.
c'est magnifique.
Wow.
Ah, ok.
Oh, fabulous.
Ok. Et viens au milieu. Viens au milieu. Congrats.